Everyone, so this video is going to be some tips and just some information on your brushing and flossing and using mouthwash for your kids' teeth. We started with Ella very young, brushing her teeth, and the same with Hannah as well. And Ella's first dentist appointment was when she was 3 years old. However, I did not take a picture at that time. Actually, the picture that I'm going to insert now is a picture that was her second visit, I think. Her first visit was to a pediatric dentist, and then her second visit was actually to a dentist that me and my husband go to. And the reason why we switched over from a pediatric to a regular dentist is just because my insurance would not accept that the dentist that I went to. However, it's just easier for us to have her go to our dentist as well because we kind of plan our appointments together. They recommend that you do go to a pediatric dentist just because they know kids and they know how to deal with them and get them to open their mouths and look in there and whatnot. The first started going at 3, so then she's had about 3 visits ever since then. And the first visit was great. She let them clean her teeth, look in there, count them, everything. And at that time, our pediatrician was recommending that we take her at 3. However, now since we've had Hannah, she recommends that when they get that, I think it's their first birthday now, they recommend that you go. It went great for Ella, and the second visit went great too. She let them clean her teeth, count them, look at them, make sure they were all okay. This last visit when she went in, I think it's beginning of December that she last went because she has another appointment in June. She didn't really cooperate with them. She didn't want to open her mouth and let them do a little cleaning of her teeth. I think she let them clean her top teeth, and that was it. She wasn't having any more. At times she's very difficult with me even brushing her teeth. I am hoping in June that she will be a whole different person, which usually she is. Every 6 months, it seems like her little personality changes. And she cooperates more with certain things that she didn't months ago. And so her next appointment is in June, and we do go to see the dentist every 6 months. Kind of anal about this because I'm a nurse who works in pre-op, and I see kids come in with lots of cavities all the time with a bottom mouth and having to pull all their teeth, and I cannot imagine a 3-year-old with no teeth, and how are they supposed to eat regular foods, and they can't, and so they don't get their teeth back in until they grow till their adult teeth come in. And so to me, I think that's just kind of detrimental to the child, and that's something that I do not want to happen to Ella or Hannah. So that's why we brush and we brush and we brush. The recommendations for brushing teeth alone is between the ages of 7 and 8, I think it is, and flossing is between the ages of 10 and 11. So I brush her teeth, I assist her with brushing. They recommend that you brush their teeth till they're 3, and then when they're 3 to 6 that you assist them in brushing, and then when they're 7 to 8, I guess, or 6 to 8 or whatever, then you can brush, then they can brush them themselves. But sometimes they don't always get in the very back. I'll show you what we do in our routine at just about every night. Anyways, so we just do a little bit, a pea size, it recommends, of toothpaste on here, and then run it under some water, right, Ella?
Yeah. Can I try some?
And basically, I don't know if you guys will be able to see this because I've got this stacked on books, but I get way here in the back, and I just brush and brush. They recommend 2 minutes of brushing. So, anyways, but yeah, I just get way back here because that's some of the teeth that really do get missed. And sometimes she'll allow me to brush, sometimes she won't. It just all depends on her mood. Okay, spit, Ella. Good girl. And then I do this again. Get her teeth really good here. Then I go up for the top. I put it just like this. And we go back in the back on the top here and just brush. The other side, brush. Then I tell her to put her teeth together like this. Do together, Ella. Do together. And I do this. Sometimes it splatters in my face, but oh well. That's how I get like the tops. I also do her tongue. Not sure if that was like a full 2 minutes, but this is just demonstration purposes only. So then I do her tongue. Stick your tongue out, baby. Okay. I do her little tongue right here. And then we kind of rinse around a little bit, right, Ella? Yeah. Okay, teeth together again so I can kind of rinse those. Okay. And then we do the mouthwash that she's grabbing for. That's like her favorite part now. She loves swishing and spitting. It's got like you just squeeze the bottle. You squeeze the bottle and it goes to a fill line. I don't put all of this in her mouth at one time just because she can't like drink all of it at one, not drink it, but swish it all at one time. So I do like half. Sometimes it's like 3 times I have to put in there. All right, Ella, close your mouth around it, baby. Here. Silly girl. And then we swish, 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 and spit out. Good girl. Uh-oh. Probably didn't get a lot in there because she spit some out before. All right, Ella, stop, honey. Touch it back. Okay. Okay, now swish, 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 swish. I always supervise her doing all of her toothbrushing care because I don't want her to accidentally swallow this. Alrighty. We don't swallow it, right, Ella? Mm-mm. Swish, 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 swish. Okay, spit. Good girl. All right. Okay, swish, 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 swish. Get it all over your shirt, aren't you, Ella? Swish, swish, swish. Spit out. Good girl. Okay, and then after they use this mouthwash, they're not supposed to eat or drink anything for 30 minutes. And it basically like brushing our teeth and mouth rinse routine. And now your teeth are squeaky clean, right? The only thing I was going to show you guys is, let me see your teeth, Ella. Show me your teeth. Show me your teeth. Is that this tooth this tooth right here is the one that is kind of like turning yellow. That's the one she fell off of our bed when she was 16 months old. She crawled off the end before I could like grab her. She tore the little top thing that goes like along here. She tore it. And basically the doctor said that she would just have a bigger smile as she got older. But anyway, so what happened was one of her tooth, this one tooth, when it hit on impact, it knocked one of the teeth back and went towards the front. And anyways, so it's like kind of yellowing, and the dentist told us that it could get an abscess, but he doubts it. Probably fall out before that happens, which we're hoping, and then she'll get her adult teeth. So anyways, tell them thanks for watching. You say thanks for watching.
Thanks for watching.
Bye.
Bye.
But it's really important to get those back ones because that's where the cavities love to get. Foods and things that we do not allow her to have, it's more like, the sugar, candy bars, and that kind of thing. We don't allow her to have those sweet, sugary like type drinks like ices and that kind of thing. She rarely ever has an icy. She loves ices, but she rarely ever has an icy. She only drinks like milk and 1 cup of juice a day, and the only reason I give her juice is because it keeps her regular, because she has constipation issues. So she gets 1 cup of like diluted juice a day, and that's it. Weaned her from opacity before the age of 2, just because our doctor, pediatrician, wanted us to. Hannah sucks her 2 fingers, so we're hoping. I tried to get her to suck a pacifier, but she wouldn't do it. I think the recommendation for thumbs or fingers is before they get their adult teeth, just because of overbite. It's what it's called, overbite. I'm hoping that Hannah will ditch the habit before she's 12 years old. 12 years old, not like her mother who sucked her thumb till she was 12. Anyways, and then I've read about health problems later in life when you don't brush a child's teeth. I know a lot of people believe that you don't really have to brush their teeth because it's not their adult teeth, it's their baby teeth, but the gums underneath always stay there. They don't ever fall out. So when you don't brush your child's teeth, it's kind of setting them up for like gum issues later on, gingivitis, and it's just not a good thing to not brush your kids' teeth. And just like I said before, they get cavities, and sometimes there's too many cavities to fill in the office, and they have to put them under to fill their cavities. When I was little, when I was a child, I had a lot of cavities because I did not brush my teeth. My parents never helped me brush my teeth, and they just made me do Listerine, and that was it. I don't recommend just doing mouthwash with your kids. You need to at least be doing, brushing, and they don't recommend mouthwash until they're like 6. The best you can do to make sure that they're going to swish and spit that mouthwash out is if you take water and you put food coloring in it, and then you swish it. Tell them to swish it around and spit it out. If they swallow it, then you know that they're not going to like spit the mouthwash out. That is what a pediatric dentist told me that I see at the hospital. Brushing the teeth and the mouthwash and the flossing, they recommend the brushing the teeth twice a day, replacing the toothbrush every 3 months. The mouthwash, 6 or when they can spit out, just like I was saying, and the flossing once the teeth touch. So, and but anyways, you can buy those little flossers that like the little princess flossers, or I think there's for the boys it's Cars, and you can use those with your child's teeth. Which I just need to go out and get some and start doing it with her. It has been a fight just to get her to brush her teeth, and now she's starting to like to brush her teeth and do the mouthwash. So I'm going to probably try to introduce the flossing now into her routine. So this is the kind of toothbrush that we use for Ella. This one's actually for 5 to 7 year olds, but she's almost 5. She'll be 5 in March, and this one does great. It's the Oral-B, and we usually get the princess ones. When we go to the dentist every 6 months, which you're supposed to replace the toothbrush every 3 months, but we go every 6 months, and they give us a free one. And they always give us one of these. So we only have to buy like 2 a year, and we get 2 free. So anyways, and then we use the Oral-B Stages, which this one is for kids who can spit the toothpaste out. They do have like toddler training toothpaste, which I thought about getting. And this is the mouthwash we use. We used Act for kids. Just like I said, they don't recommend this until 6, but Ella can swish it around and spit it out. She does not swallow this. And anyways, I had a $1 coupon for this. We were at the dentist's office, and I just bought this, and she loves using this. They have all different kinds. They have a pink Barbie one, they have a green Scooby-Doo one, and they have this SpongeBob blue one as well. And what we do basically for Hannah is we just like take a washcloth and just go along her gums and kind of clean them at the end of the day. So this is the gum cleanser that we use. This is like an informational video. It's not like medical advice or anything like that. You should definitely talk to your pediatrician and what their recommendations are as far as going to the dentist. And they probably also have a list of all the dentists in your area that you can go to, and that accept your insurance. You just have to like make sure they accept your insurance. If you guys have any questions for me, let me know. I'm gonna now put the video in of Elle and I showing you what our routine is. Thanks for watching.